Today on HealthWise, we're talking with Dr. Jennifer Tiener at Winona Health. We're going to talk about antibiotics. And Dr. Tiener, thank you for taking some time to talk with us today.
Thank you for having me here today.
I know you're new to the Winona community. We want to welcome you to Winona and also tell us a little bit about why you chose Winona Health to do your practice.
Well, I'm originally from Colorado in a smaller town, and I moved out to Philadelphia for med school and training, and I realized I wanted to be back in a smaller town. And I had good friends who moved here, and they really enjoyed it, so I decided to move here as well.
So we're going to talk about colds and antibiotics today, and colds never seem to go out of season. They're around pretty much the full year. So what is a cold? I think people get colds and flus kind of mixed up.
Sure, so they're both fairly similar. Colds and flus are usually caused by a virus, and they affect your nose, throat, and sometimes lungs. So basically they cause a lot of misery, a stuffy nose, sneezing, some pain in the ears, pain in the throat, and can cause some coughing. Can make you pretty miserable for about 5 to 7 days.
And now let's answer the second part of our topic today. Can you tell us what is the definition of an antibiotic?
An antibiotic is a medicine that's very effective against killing bacteria, which is not the source of your infection with a virus and a cold.
So when we are prescribed an antibiotic, what exactly does that antibiotic do?
When people are prescribed an antibiotic, it's usually for a more severe infection, either in their nose or their lungs, so a sinus infection or pneumonia, and that will kill the the bacteria in their nose or their lungs. These infections are usually more severe infections. You're going to have a fever, prolonged misery. You're usually sick for about 10 or more days, and much sicker than your general cold or flu.
So what are some of the situations where we should take an antibiotic?
If your symptoms last for more than 7 days, or you get initially a little bit better after your cold and you get a lot worse, you have a fever, or you have a very prolonged cough, then we do sometimes treat you with antibiotics.
We've heard a lot about taking antibiotics, and taking them too often is not good for us. What is the risk if we don't need an antibiotic and we take it anyway?
An antibiotic is a very good medicine for killing bacteria in your body. We have both good and bad bacteria in our body at all times, mostly in our gut. We have some in our nose, in our throat, which protects us against infection and also keeps our bowels running normally. So if we take an antibiotic too often, we can take away the good bacteria, which can cause uncomfortable side effects like diarrhea, can also cause very serious infections to happen when we strip away the good bacteria.
Dr. Tiener, thank you for taking time out of your schedule to talk with us a little bit about colds and antibiotics.
Great, thank you for having me.